And to welcome this breakthrough idea, please welcome Michael Dowling, CEO of Northwell. I also want to make sure that we recognize the incredible contributions of Procter & Gamble and Johnson & Johnson to make this announcement of 50 scholarships happen. Please give it to Johnson & Johnson and Procter & Gamble. Thank you so much for your generosity. Michael, it's an honor to have you here on stage. It's an honor to be able to actually have 50 nurses that are going to become, 50 Latinos that are going to become nurses. Tell me, why is this important?
Well, first of all, let me say a special thanks to you, to the organization, and obviously to everybody here that is committed to doing the right thing. I mean, we have an opportunity right now to change the future, to do things differently. And if you get people that are really, really committed, that form partnerships, that to create the right pipeline for new nurses to get into the business of healthcare delivery, we're going to change the way patients are treated. So, you know, the demographics are changing. We are unbelievably committed at Northwell to making sure that we change, we enhance education. We do education differently. You're going to be hearing in a minute from Dr. Kathy Gallo, who is the Dean of our nursing school. And we will have, within a very, very short period of time, over 1,000 nurses in training and education. And we have to enhance the diversity. We have to enhance the way and change the way we actually train nurses. And Kathy will talk a little bit about this. Because the world is changing. The last 2 years have changed an awful lot. The last 2 years demonstrated a lot of the how certain populations are disproportionately affected by COVID. And the only way we can actually change that in a long term is actually changing the nature and the diversity of the workforce that we have and create new pipelines. And we're very, very focused on this. And this is not just only, I would say, for the Hispanic population. We should be thinking not just only about nurses. We should be thinking about medical school. Right, we should not limit ourselves with the possibilities of what can be achieved here. And we're delighted to be a partner with you on this as you move forward, because we want to do things differently. We want to challenge the status quo. We want to be a real change agent. And we want to be in a better position to be able to take care of the populations that we need to take care of. And you can only do that if you have representation on the provider side that is similar to the populations that we actually treat and take care of. Otherwise, you're not going to get the same benefit, and you're not going to provide the same quality of care. So this is an opportune moment post-COVID to think differently and reimagine how we do things going forward.
This is a very, very personal thing for me, Michael. I think that I shared with you my mother died of COVID last year after 169 days of being hospitalized, where I saw, and I was part of, like the nurses being around me and around my mom, going above and beyond day after day, giving us hope, giving us care, giving us like everything so that she could actually get better, so that we as family could understand. Then I learned, Michael, that, like Latina nurses are paid 70% less than their counterpart in the industry, and that 44% of Latinas were burned out after COVID. And nevertheless, we didn't give up. We didn't quit. We were not part of the Great Recession, and we kept on going. So for me, being able to have a Hispanic Star Healthcare Hero program that we start with Northwell, with the largest institution, healthcare institution in the state, it's a real privilege, but also an incredible opportunity. If we don't act, we're going to have a shortage of 1 million nurses. If we don't act today, in 3 years, this country is going to have 1 million less nurses, and that is going to be a problem for America altogether. So I think that, again, I cannot be more proud and at the personal level to have, like an initiative that is touching the lives of someone that were so closely. They have been heroes all along, but I think that through COVID, we were able to see them even more. So a big, big recognition goes to nurses and to institutions that further and continue nurturing nurses becoming nurses.
Thank you so much. Appreciate it. Thank you.
Anything else? A final message?
Yeah. COVID changed our perspective on a lot of things. we're all different because of the last 2 years. At Northwell, we actually treated 235,000 COVID patients. We treated more COVID patients than any other single entity in the United States. So it forces you to think a little bit differently about the future that you want to create. And if you're in the healthcare business, as we are, the only way you can change it is with the people that you have working for you on the front lines. And the people that you train to be leaders on the front lines and leaders in middle management and senior management. And now we have this wonderful opportunity, and the help that you're providing is another incentive in that regard, is for us to continue to do more. We are in an unbelievably diverse community, New York, but our workforce doesn't represent the communities that we serve to the extent that they should. And we can only change that by changing the pipeline that we create for people to go into the nursing field. And I'm actually privileged to be here, privileged to have the opportunity to figure out, working with you and others, to figure out how we do things differently. And we shouldn't replicate what existed before. We should create something new going forward. So as Kathy Gallo will explain when she comes up here, and we did this with our medical school as well, we have to change the way we educate. We can't just educate the way we did. We have to change the way we educate, because the environment is very different today than it was before. And it's not just only because of COVID, but COVID is an added incentive. So it's creating a bigger pipeline, enhancing diversity, providing wonderful career opportunities for people, so that there's a whole economic, social, family benefit to doing this as well. You provide a wonderful, in many ways you're creating hope. You're building hope for the future when you bring people in to give them the opportunity to go into a field that they love. I'll just give you one last thing. As you can tell, I'm not from the United States. I'm an immigrant.
Mexican.
And if it helps, I'll be Mexican. But, we're all immigrants, and every single one of us. But I am here today because of education. I left home as a 16-year-old by myself. And education was the opportunity. Education gave me the opportunity to do the things I've done and to be where I am today. So I'm a huge, huge advocate for education, for opening up the doors of opportunity for people. One of the things that we will be announcing in the next couple of months is a scholarship program for poorer families to pay for community college education. You take a family where nobody ever before went to college, and you give that one person in that family the opportunity to go to college. You change the family. You don't change. You don't change just the individual. My family got changed because I left home, because we lived in severe poverty when I grew up. But my family was changed because I got an opportunity to leave and move into education. My life changed, but my family's life changed. So we are also going to be providing scholarships through Northwell ourselves for people to move into the field of healthcare delivery, whether it be nursing, medical school, etc. So we have huge pipeline programs. And if we train people the right way, open up the opportunities for people to do great things, we will change so much. And that's the opportunity we have right now, is to be innovators in changing the way healthcare is delivered.
And if affecting one person affects a village, well, here is to 50 scholarships that can affect 50 villages, thanks to the generosity of Procter & Gamble, Johnson & Johnson, implemented by Northwell. Here to the Hispanic Star Health Heroes. Thank you so much.